Prosthodontics is a branch of dentistry that specializes in the restoration and replacement of lost or damaged teeth. May be lost or damaged beyond repair as a result of tooth decay, gum problems, accidental injury or trauma. Some patients may also be born with abnormal or missing teeth. Well, once a person starts losing their teeth, their ability to chew and eat may start to decline. This can result in poor nutrition. Sometimes, having missing teeth can also affect a person's self-confidence, especially if they find it difficult to socialize as a result of these eating difficulties or if it affects their smile. Replacing missing teeth enables a person to maintain and restore their ability to chew and eat food, which is important for nutrition and health. It also helps to improve their appearance, especially their smiles. Treatment options to replace missing teeth include removable dentures, fixed bridges supported by natural teeth, or braces. Removable dentures are not fixed. They have to be removed frequently for cleaning and hygiene purposes. They may feel unnatural at the beginning and will require a lot of time and practice for the patient to get used to them. The ability to chew with dentures is also reduced because they require support from gums, which may be weakened after losing the natural teeth. Fixed bridges supported by natural teeth are cemented over existing teeth. Although fixed and not removable, they require some teeth to be trimmed, grinded, or damaged in order for this treatment to be done. Braces are usually done to correct crooked teeth, but in some instances, this may be done to close gaps caused by missing teeth. Dental implants are titanium screws that are placed into the jawbone. This can be done under local anesthesia, like having an injection when you are doing fillings or extractions. After this, the implant and the bone will be left alone to mature for 3 months. A crown will then be made and connected to the implant after this. Dental implants can also be used as bridges if many teeth are missing or need replacement. For example, 2 implants can be used to replace 4 missing teeth. In some cases where patients have lost all their teeth, 4 implants may be sufficient to replace 14 teeth in one jaw. In addition, they can also be used to support dentures that are loose or unstable. Dental implants can be used to replace missing teeth permanently, restoring not only your ability to chew, but also your smile. They feel similar to natural teeth, unlike dentures which can feel unnatural and may be difficult to use. In addition, natural teeth do not need to be trimmed or damaged in the process, like fixed bridges supported by natural teeth. They can last a lifetime if properly cared for. Anyone in good health can choose to have dental implant treatment. Even patients in their 80s have received successful dental implant treatment as long as they are generally healthy. Anyone who has missing teeth, teeth that are damaged beyond repair, or unhappy with their dentures should consider dental implant treatment. Although best done soon after the tooth is extracted, they can still be done many years after the tooth has been lost, sometimes even at the time of tooth extraction.